Hello Professor, my name is Manpreet Kaur. My student ID is 1156488248 and I am here for the wound dressing procedure. Here is the 360 view of my room. Hello, my name is Manpreet Kaur. I am your student nurse today and I am here for your wound dressing change which is prescribed by your doctor. May I know your full name please?
My name is Divya Sachdeva,
And your date of birth?
14 June 2001.
And can I check your band so that I can cross check with my documentation? Okay. So now I'm done with my hand washing. Privacy is maintained. Going to reposition. Okay, Devda. Before moving forward, can you please tell me, do you feel any kind of pain in your wound? Or if you does, can you please rate it from 1 to 10 on the scale? 1 is the weak and the 10 is the worst.
Around 3.
Okay. So do you need any kind of medication for your pain or you can just tolerate it?
I can tolerate it.
Okay. So can you please tell me, do you have any kind of allergies of any medication?
No.
So the patient has a mild pain in the wound dressing and she can tolerate the pain very easily and she don't have any kind of medication allergy. So moving forward, I am going to put the absorbent pad under the bed just to make sure it doesn't soil the bed, and we're going to place reposition it, the dressing area, and now I am going to do the gloving. So now I am going to open my sterile kit. For that I need to create a sterile triangle for it, as I am putting the flap away from me and putting the right side to the right hand, putting the left side to the left hand, just to make sure it doesn't touch anything, and going to pull the this flap toward me and try to arrange the kit. Okay, so arranging the forceps. Putting this forceps at the edge. Taking the normal saline, pour it. So okay, now I open my sterile kit. Moving forward, I'm going to open the wound. As I can see that there is discharge present, which is a serous discharge, which is lightly yellowish and pinkish in color. There is no foul smell present in it. So ideally we need to discard this in the BMW waste. I don't have the sterile one, so I'm using it again. I'm just putting it here. Moving forward, now I'm going to do the wound assessment, and in the inspection I can see that the wound is located at the medial lateral aspect of the forearm, and yes, so now I'm going to check the length of the wound with the scale, just to make sure that the scale doesn't touch the wound. So the length of the wound is 6 centimeter. So going to check the closure of the wound, as I can see that wound is enclosed with the 7 staples, and there is no redness around the wound, so there is no sign of erythema. and the proximity is well maintained, and uh, the wound edges are secured and enclosed perfectly. And now I'm going to palpate the wound just to check the sign of edema and pain. Okay, Divya. Now I'm going to palpate. If you feel any kind of pain, just tell me. So do you feel any kind of pain?
No.
Okay, so there is no sign of pain and edema present. Now moving forward, now I'm going to clean the wound. Just going to pick the forceps. Take the first swab, dip it in the normal saline, squish it. Now I'm going to clean the wound from the center first, from top to the bottom, from the least to most contaminated area, and putting the soiled swab in the dustbin. I'm going to take the another one. Dipping it, squeezing. Now going to clean the farther area from top to bottom. Putting in the dustbin. Again taking the another one. Dipping, squeezing. Going to clean the nearer area of the wound from top to bottom. Putting in the dustbin. Now I am going to pat dry the wound with the gauze piece. I am doing it again in the same technique. Going to pat dry from the center, from top to bottom, using one stroke, one swab technique. Take the another gauze, pat dry the farther area of the wound from top to bottom. Another gauze, going to pat dry the nearer area from top to bottom, putting that in a bin. Now I'm going to use 4x4 gauze to cover the wound. Now going to put the forceps at the edge and going to take the sterile bandage to secure the wound. And importantly, going to write the time and date of the dressing changed, just to let other nurses know when the dressing was changed last time. Now I'm going to clean all the area and put all the supplies in the BMW waste accordingly, and going to document the findings. And here is the 360 view of me. Thank you, Professor.